to reduce the risk of positional asphyxia. As we have seen, the risk of positional asphyxia is high, and recognizing if someone is affected can be difficult. If restraint is necessary, there are ways to ensure that you minimize the risk. For example, 1. Avoid anything that restricts the chest and abdomen in a prone, kneeling, or forward reclining position. 2. Do not restrain someone by bending them forward. 3. Do not put weight on someone's back. 4. Constantly monitor the individual. 5. Only restrain the individual for as long as necessary. Periods of prolonged restraint can lead to exhaustion. This can also lead to a buildup of metabolites, which can be toxic. This can lead to life-threatening situations, especially if the individual has medical conditions or has been using drugs. This means that just avoiding certain physical restraints can still result in a dangerous situation. So regular checks should also be made on the vital signs using the ABC method to check these. These are A for airways, B for breathing, and C for circulation. And thank you very much for your attention. And if you like it, subscribe and also share it with others. Bye for now. Ladies and gentlemen, I'm Dr. Prosper Tettey Doe in the United Kingdom, practicing psychiatrist. I'd like to present on our topic, positional asphyxia. Positional asphyxia simply is when there is a decrease in oxygen while in excess of carbon dioxide, that is high hypoxia. Conditions which will form positioning in the prone position with the abdomen face down. Example, in restraint can have an adverse effect on the ability of someone to breathe, as the lungs play an important function in inhaling. Expanding your chest draws in air into your lungs, and when resting, we don't really need much expansion to fulfill the oxygen we need. Compare this to after doing exercise and your body needs much more oxygen, so your lungs need to expand much more. Issues begin to happen when the body is unable to expand and the lungs fully are not expanded, so the oxygen requirement is not being met. In an excited situation where restraints may be needed, this restraint has the capacity to deny the body the extra oxygen it requires. This oxygen deficit can be increasingly hard to notice, as an individual can appear normal but have an oxygen deficit forming. They can be making noises and engaging, and then suddenly fall out of consciousness. The next, we'll be talking about positional asphyxia risk factors in restraints. Any restraints comes with the risk that breathing could be restricted. This is because the mechanical process of breathing has been restricted. There are factors that can heighten an individual risk. 1 is heightened demand for oxygen. 2, obesity. 3, mental illness. 4, small stature. 5, intoxication. 6, excited delirium state. 7, physical ailments. Prolonged restraint and struggling can result in exhaustion, reduced breathing, leading to building up of toxic metabolites. This with underlying medical conditions such as cardiac conditions, drug use, or the use of certain antipsychotics can result in sudden death with little warning. So this needs to be taken note of with little warning. Patient restraint time should be kept to an absolute minimum. The degree of restraint use must be justifiable, reasonable, for the minimum time necessary, and proportional to the situation. And we've had instances in this country and elsewhere where security forces have restrained people, albeit justifiable or reasonable, but not for the minimum time necessary and not proportionate to the situation. And unfortunately, that has led to the death of such people.